I'm Linda Salin, Information Specialist for the Interstitial Cystitis Association. We've recently had a lot of young people with IC contact us, and they have special problems that maybe some people in the older population do not have. They have a disease that's chronic, that may be with them for the rest of their lives, and they're just starting out in their life, and they don't really know how to handle it. They don't know how to tell friends what's wrong with them. They don't know how to explain it to their teachers, their parents. They may be ready to go off to college, afraid of living in a dorm with dorm food, afraid of not having access to a bathroom all the time. They're maybe afraid of developing a sexual relationship with a partner and not understanding that they may have pain with IC. So I think we have some good guidelines on our website for them, and I think the advice we can offer is to contact the ICA. We can send you some brochures that explain what the condition is that you can give to your friends and family. We also have some books that are on IC and dealing with friends and family, so that you don't have to constantly be talking to somebody and explaining the situation to them. Let them read and understand what you're going through. Feel free to talk to the dietitian at the school where you're going to live and to your roommates and tell them what your dietary needs are. You don't have to go overboard. You don't have to explain the whole situation. You can simply say something like, I have an allergy to certain foods and it causes a reaction that I find uncomfortable and embarrassing, and I've got to do certain things and eat only certain things. I shouldn't drink alcoholic beverages. I'm under good care. I may have to take certain medications. I may have to rest more. Be sure to go to these school doctors if you're going to college and give them some information about IC so that they know how to handle things should a flare arise and you need to be seen by them or the nurse. And the best advice is just understand this is a pretty normal problem in the patient population. Years ago, we know people had it at your age, but it wasn't recognized and it wasn't diagnosed until they were much older, so it got worse with time. But you were diagnosed early, you're going to get good treatment and you're going to respond much better to the therapy. If you educate yourself about this condition, about the therapies, find out what your triggers are, what foods and beverages to avoid that may make you flare. And if you're in a relationship that's sexual, hopefully you know the person well enough that you can explain what your possible limitations are and that there are things that can help you with this. Get on our website under sexuality, get on our Facebook page and start to get messages on the message board, and you'll find a lot of people your age will respond to you with helpful suggestions.